The fundamental danger of hantavirus is not merely the pathogen itself, but the way human behavior can inadvertently transform a dormant threat into a lethal airborne mist. Public health officials are issuing a stark warning that mirrors a recent investigative headline. A simple dry cloth, used improperly in a contaminated environment, can effectively function as a suicide tool. This is because the primary route of hantavirus infection is through the inhalation of aerosolized particles. When rodent droppings, urine, or saliva dry out, the virus remains viable within the organic matter. Any activity that disturbs this material, such as sweeping with a broom, vacuuming, or using a dry duster, propels microscopic viral particles into the air. Once airborne, these particles can be inhaled deep into the lungs, where the virus begins its rapid and often devastating assault on the respiratory and circulatory systems. This mechanism explains why otherwise routine spring cleaning or the reopening of a long-closed seasonal cabin can result in sudden, life-threatening illness. +4. This risk has been brought into sharp international focus during the first week of May 2026, following a severe outbreak linked to the cruise ship MV Hondius. This Dutch-flagged vessel, which departed from Ushuaia, Argentina, in early April, became the site of a multi-country public health investigation after a cluster of passengers developed severe acute respiratory distress. As of May 10, 2026, the World Health Organization and the European Center for Disease Prevention and Control have confirmed at least 3 deaths and several other infections. The geography of this outbreak is critical, as it traces back to the southern cone of South America, specifically Argentina, where the Andes strain of hantavirus is endemic. Unlike many other hantavirus strains found globally, the Andes variety is uniquely concerning to epidemiologists because it is the only strain known to occasionally allow for human-to-human transmission through close contact. This adds a layer of complexity to the surveillance efforts currently underway as passengers from the ship return to their home countries, including the Netherlands, the United Kingdom, and South Africa. +3. To understand the stakes of this reporting, one must distinguish between the 2 primary clinical presentations of the virus. In the Americas, the focus is on Hantavirus Pulmonary Syndrome, or HPS. This is a severe, sometimes fatal, respiratory disease. It typically begins with symptoms that mimic a common flu, fever, muscle aches, and fatigue, but it can progress with terrifying speed to a stage where the lungs fill with fluid, leading to severe shortness of breath and shock. In Europe and Asia, the virus more commonly manifests as hemorrhagic fever with Raynaud syndrome, which targets the kidneys. While both are serious, HPS is noted for its high case fatality rate, which historical data suggests can reach as high as 50% in the Americas. Current reporting for 2025 indicated that across 8 countries in the Americas, there were 229 confirmed cases resulting in 59 deaths. The 2026 cruise ship incident represents a rare but high-profile instance of the virus traveling through the logistics of international tourism, shifting the narrative from a purely rural, isolated risk to one involving global travel corridors. The investigation into the MV Hondius outbreak has provided a detailed look at the clinical and logistical challenges of managing a hantavirus cluster in a confined environment. Public health agencies, including the Netherlands Early Warning and Response System and Japan's Institute for Health Security, have been tracking the timeline of the infection. The suspected index case, or patient 0, has been identified by news reports as a 70-year-old Dutch ornithologist who had visited a landfill site in Argentina, often referred to as the end of the world, prior to boarding the vessel on April 1, 2026. This detail is significant for surveillance teams, as landfills and rubbish tips are known high-risk environments for rodent activity. The ornithologist reportedly developed symptoms including fever and gastrointestinal distress on April 6 while on board. By April 11, his condition deteriorated into full respiratory distress, and he died before medical evacuation was possible. The complexity of the situation grew as his wife also succumbed to the illness. She disembarked the ship and experienced a rapid decline while attempting to board a flight from Johannesburg, South Africa, to the Netherlands on April 25. She died upon arrival at the emergency department the following day. These cases highlight the silent incubation period of hantavirus, which health officials state can last anywhere from 1 to 8 weeks. This long window creates significant hurdles for travel and shipping logistics, as individuals may appear perfectly healthy while crossing international borders, only to become critically ill days later. In response to this specific cluster, the World Health Organization has advised that all passengers and crew members from the affected voyage undergo active symptom monitoring for at least 45 days. +1 laboratory and clinical reports from the current May 2026 crisis indicate that diagnosis is primarily achieved through PCR testing and serology. On May 2, 2026, the United Kingdom's National International Health Regulations focal point notified the WHO of the cluster after laboratory testing in South Africa confirmed hantavirus in a critically ill patient. Following this, the Dutch government confirmed the identification of the Andes hantavirus strain through molecular analysis. This identification is a critical development for hospitals and clinics. Because the Andes strain has a documented history of human-to-human transmission, medical facilities must implement not only standard precautions, but also transmission-based precautions for suspect cases. This includes the use of personal protective equipment and the isolation of patients to prevent secondary infections among healthcare workers and other patients. While the global risk is still assessed as low by the WHO, the mortality rate observed in this specific outbreak, with 3 deaths among 8 identified cases, underscores the virulence of the South American strains. Prevention and public guidance remain the most effective tools in the absence of a licensed vaccine or specific antiviral treatment for hantavirus. Public health agencies, including the U.S. National Park Service and the Mayo Clinic, emphasize a wet cleaning protocol that is diametrically opposed to standard dusting or sweeping. To safely clean an area where rodent activity is suspected, the first step is thorough ventilation. Windows and doors should be opened for at least 30 minutes prior to entry, allowing the air to circulate and reducing the concentration of any airborne viral particles. Once the area is ventilated, the clean or die warning regarding dry cloths becomes paramount. Surfaces must never be swept or vacuumed. Instead, individuals are instructed to use a disinfectant or a freshly prepared bleach solution, specifically a 1:10 ratio of bleach to water. +1, the protocol requires that the rodent droppings, nests, or carcasses be thoroughly soaked with this solution. The disinfectant must be allowed to sit undisturbed for at least 10 minutes to ensure the virus is completely inactivated before any physical removal begins. During this process, the use of rubber or plastic gloves is mandatory. For heavy infestations, health officials recommend the use of respirators and goggles. The disposal process is equally meticulous. Contaminated materials should be picked up with paper towels or an inverted plastic bag, sealed in a double bag, and placed in a secured outdoor trash receptacle. Following the cleaning, gloved hands should be sprayed with disinfectant before the gloves are removed, and hands must be washed thoroughly with soap and water. +1, beyond immediate cleaning, long-term surveillance and environmental management are the keys to community safety. This involves rodent-proofing structures by sealing any holes larger than a 1/4 inch with durable materials like steel wool or metal flashing. Public health guidance also suggests moving wood piles, compost bins, and dense vegetation at least 18 inches away from building foundations to eliminate nesting sites. Despite these clear guidelines, significant uncertainties remain. Scientists are still studying why certain years see a boom in rodent populations, often linked to climate patterns and food availability, which in turn leads to a spike in human cases. In Argentina, officials have noted that 2025 and early 2026 have seen an increase in infections partly attributed to environmental changes affecting rodent habitats. While researchers continue to work on diagnostic tools and supportive care strategies in high-tech labs, the most basic advice remains the most life-saving. Treat every rodent-infested space as a potential biohazard and put down the dry cloth. Please consider subscribing for more in-depth public health reporting and global news updates. The clinical and institutional response to the current hantavirus outbreak has mobilized a global network of public health agencies, including the World Health Organization, the European Center for Disease Prevention and Control, and the U.S. Centers for Disease Control and Prevention. Central to the investigation is the Dutch-flagged cruise vessel MV Hondius, which has become the focal point of a multi-jurisdictional effort to contain the Andes virus strain. On May 2, 2026, the United Kingdom's National International Health Regulations focal point first alerted the WHO to a cluster of severe acute respiratory illness among the ship's 147 passengers and crew. By May 8, the situation had escalated to 8 reported cases, comprising 6 laboratory-confirmed and 2 probable infections, with a confirmed death toll of 3 individuals. This yields a case fatality ratio of approximately 38%, a figure that aligns with historical data for Hantavirus Pulmonary Syndrome in the Americas, which can reach as high as 50%. The index case has been identified by authorities as a passenger who died on April 11, while the ship was in transit. His remains were later held in St. Helena, pending repatriation to the Netherlands. A second fatality occurred when a female passenger died shortly after arrival at a hospital in South Africa on April 26. +4. The logistical complexity of the response is centered on the ship's route through the South Atlantic, which included stops at South Georgia, Tristan da Cunha, and Ascension Island before arriving in the Canary Islands. Because the Andes virus is unique among hantaviruses for its documented capability of human-to-human transmission, the ECDC and Spanish authorities have implemented stringent protocols at the port of Santa Cruz de Tenerife. Passengers classified as close contacts are not permitted to use regular commercial aviation for their return journeys. Instead, the European Civil Protection Mechanism is coordinating specialized medical repatriations. In the United States, the CDC has deployed a team to the Canary Islands to coordinate the return of American citizens to specialized facilities, such as the Biocontainment Unit in Nebraska, where they can be monitored in a controlled environment. Health officials emphasize that while the risk to the general public remains extremely low, the risk to those who shared the confined environment of the ship is categorized as moderate, necessitating a full 42 to 45-day monitoring period from the date of last exposure. +3 laboratory verification of the pathogen has been a primary hurdle due to the virus's long incubation period, which ranges from 1 to 8 weeks. Initial diagnostic efforts focused on a broad respiratory pathogen panel, which returned negative results for common illnesses like influenza and COVID-19. It was not until May 3, 2026, that PCR testing, polymerase chain reaction, confirmed the presence of hantavirus, with subsequent genetic sequencing on May 6 identifying the specific Andes lineage. Specialized laboratories, including the National Microbiology Laboratory and the European Reference Laboratory for Public Health, are now utilizing metagenomic analysis to study the viral load in confirmed patients. Clinical guidance for hospitals currently managing these cases dictates the use of airborne infection isolation rooms, because Andes virus can be shed through respiratory secretions and saliva. Healthcare workers are required to use N95 respirators, eye protection, gowns, and gloves. This level of precaution is a significant escalation from the standard droplet precautions typically used for other hantavirus strains, reflecting the specific risks of the Andes variety. +1, the surveillance effort extends beyond the ship to the point of origin in Ushuaia, Argentina, where the virus is endemic in local rodent populations. The Africa CDC and other regional bodies are tracking the movement of passengers who disembarked earlier in the voyage to ensure no secondary clusters emerge in southern or western Africa. Official statements from the WHO and the London School of Hygiene and Tropical Medicine have sought to manage public concern, clarifying that while the disease is severe, it does not possess the high transmissibility seen in pandemic-level respiratory viruses. The current strategy focuses on aggressive case isolation, international contact tracing, and the use of the early warning and response system to share real-time data between member states. As of mid-May 2026, the ship is operating at reduced capacity to allow for social distancing among the remaining crew and passengers, while thorough environmental decontamination of the vessel is conducted under the supervision of international health inspectors. The mitigation of hantavirus risk relies on a paradigm shift in domestic and industrial hygiene, moving away from traditional dry cleaning methods toward rigorous, chemically-based protocols. Public health officials emphasize that in any environment where rodent activity is suspected, such as cabins, sheds, or storage units, the standard use of a broom or vacuum cleaner is a high-risk activity. These methods agitate dried rodent excreta, creating a fine mist of viral particles that can remain suspended in the air for extended periods. To safely manage these spaces, the wet cleaning method is the only recognized standard. This protocol begins with a mandatory ventilation period. Windows and doors must be open for at least 30 minutes to allow fresh air to dilute any existing aerosols. Once the area is ventilated, any visible evidence of rodents, including droppings and nesting materials, must be thoroughly saturated with a disinfectant. The most accessible and effective solution is a mixture of 1 part household bleach to 9 parts water. This solution must remain in contact with the biological material for a minimum of 10 minutes to ensure the virus is completely inactivated. Only after this soaking period should the material be removed using paper towels or a damp cloth, while wearing non-porous gloves and, ideally, a high-efficiency particulate air mask or N95 respirator. The long-term prevention of hantavirus is fundamentally an environmental and structural challenge. Surveillance program conducted by organizations like the U.S. National Park Service and various ministries of health emphasize the rodent proofing of human dwellings. This involves a meticulous inspection of building perimeters to seal any entry points larger than 1/4 of an inch, which is the size of a standard pencil. Materials such as steel wool, metal flashing, and cement are recommended because rodents cannot easily gnaw through them. Beyond structural integrity, public guidance stresses the removal of attractants. This includes storing all food, including pet food and birdseed, in airtight, chew-proof containers and maintaining a clean perimeter by removing dense brush and wood piles from within 20 feet of the home. In rural settings, where the virus is most often endemic, these measures are the primary line of defense. However, the 2026 cruise ship outbreak has demonstrated that surveillance must also extend to high-traffic international corridors. Travel hubs and transport logistics providers are increasingly being integrated into zoonotic surveillance networks to identify potential spillover events before they reach urban centers. Despite decades of research, significant limits to our medical knowledge regarding hantavirus remain. As of May 2026, there is no globally licensed vaccine for the North or South American strains of the virus, nor is there a specific antiviral treatment that has proven universally effective in clinical trials. The cornerstone of medical intervention remains aggressive supportive care. For patients who progress to Hantavirus Pulmonary Syndrome, this often requires admission to an intensive care unit for mechanical ventilation and, in severe cases, extracorporeal membrane oxygenation, or ECMO, to oxygenate the blood outside the body while the lungs recover. The early stages of the disease present a particular diagnostic challenge, as the initial symptoms of fever and muscle aches are indistinguishable from common viral illnesses. It is only when the rapid onset respiratory phase begins that the clinical picture becomes clear, often leaving a narrow window for life-saving intervention. This underscores the importance of honest communication between patients and doctors. Individuals who have been in areas with known rodent activity must proactively disclose that exposure if they develop a fever, as this history is often the only clue that allows for early hospital admission. The ethical responsibility of public health reporting in this context is to balance the gravity of the disease with a measured, factual assessment of risk. While the mortality rate of hantavirus is objectively high, it is not a highly contagious disease in the way seasonal influenza or other respiratory pathogens are. Even with the Andes strain, which permits limited human-to-human transmission, the primary threat remains environmental exposure. The goal of current surveillance and public guidance is not to instill fear, but to replace dangerous cleaning habits with science-based safety measures. As the 2026 investigation into the South Atlantic cruise cluster continues, health agencies will focus on the lessons learned regarding international travel logistics and the potential for zoonotic pathogens to move through global trade routes. For now, the most effective tool remains local awareness and the simple, disciplined application of wet cleaning protocols. By understanding how the virus moves from the environment to the lungs, individuals can effectively neutralize the threat before it begins. To stay informed on evolving public health situations and investigative reporting from around the globe, consider subscribing for our latest updates.